Yeah, I mean, what about the non-COVID related health costs? I mean, I think we saw 29 million hospital appointments missed, 3 million cancer appointments missed. We've seen suicide now at the highest rate on record. Can you talk about some of the data we're seeing there, or how to also quantify that or make it relative to the other data?
Yeah, so I was actually looking at the Wales specific data this morning and a little bit on England. So at the moment in Wales, the number of people in hospital with either confirmed or suspected coronavirus is over 1,000. We've got about 7,500 people in hospital in Wales, but the number of people with confirmed or suspected coronavirus is over 1,000. But the number of people in Wales over the last month hasn't actually changed. So as we've been seeing increasing numbers of COVID patients, we've also seen decreasing numbers of non-COVID patients. And if you look at the data on, say, people who are attending A&E, so normally you'd expect around, say, 2 million people a month to be visiting A&E in England. Now, when we had the first national lockdown, that halved actually. We went down to 1 million people in April visited A&E. Now, the lockdown may have meant that fewer people were having accidents or needed emergency treatment. So there'll be a little bit of an effect on there, but I don't think it would quantify halving. And then it did creep back up as we started going back to our lives a little bit more normal than when we had the lockdown back in March. But at the moment, it's still about 300,000 lower than the average that we would expect for the time of year. So it's about 1.7, 1.65 million. So there's numbers of people who are not going and seeking treatment will obviously be having damaging impacts on those individuals' health. And what the ONS also publish, we talked about excess deaths. They also publish the number of excess deaths by looking at the place where the deaths are occurring. And what we're actually seeing is the number of excess deaths in the country at home is actually higher than average. So more people are dying at home this year than we've seen over the last 5 years. And that may be a consequence of two things. It could be that people are reluctant to go and seek medical attention through the NHS because they don't want to go and visit hospitals, etc. And then they're sadly dying. It could be that people are choosing to die at home rather than go into hospital if they're towards the end of life, etc. But it is a worrying trend that we're seeing, that fewer people going to hospital, more people then dying at home than what we'd expect. And you can clearly see, if you talked a little bit about the cancer statistics, you can clearly see in the data that there have been fewer people diagnosed with cancer this year. Fewer people are starting treatment for cancer, but we've got no evidence, for example, that the number of cancer patients in the country would be any different to normal. So we could see some longer lasting impacts of all of this as we go through into the next couple of years.